It's very important that survivors first recognize how resilient they are. And I'm talking about patients who have just received a diagnosis, patients who are living with chronic lymphomas, and patients who have received treatment and are in a survivorship phase after completing treatment for curative intent lymphomas. That resilience, though, is very hard-earned, and there are a lot of things survivors need to know about their path going forth. One of the most important is that survivors are at an increased risk for depression, anxiety, and post-traumatic stress disorder. Being vigilant about your mental health and how you're feeling and reaching out for support is really important. Other than that, there are a variety of late side effects. So different than the side effects of treatment you experience while you're going through treatment, there are side effects that can come later on. Things like effects on fertility or second cancers, problems with the heart due to chemotherapy. These are all things that a mindful provider needs to surveil with their lymphoma survivor. Oftentimes, adolescent and young adult survivors are at phases of their life where they may be moving locations and moving jobs and switching healthcare. It's really important that you make sure whoever is leading your healthcare team, whether that's a primary care physician, a lymphoma hematologist, a nurse practitioner in a community practice, that person needs to be aware of your lymphoma history and any treatment that you've received so that they know how to manage you going forth and anticipate the possibility of those later toxicities. It takes being very proactive as a lymphoma survivor, and especially in the adolescent and young adult age range. There's so much going on in your life, new job, family growing, all sorts of challenges at work or school. And so to prioritize one's health, it's something we can do kind of in the middle of the diagnosis and the treatment. But going forth, you also need to make sure that you advocate for yourself, that you have a healthcare team that's aware of your lymphoma history and what to look out for in terms of any late toxicities or concerns for relapse. So always talk to your healthcare team about any new or concerning symptoms that you're having and educate yourself on what to look out for. Some things include that lymphoma cancer survivors are increased risk for skin cancer, and they need to be vigilant and see dermatologists and be a little more careful in the sun than others. They're at risk for more mental health conditions, and so again, connecting and getting resources if you're noticing that you're not feeling yourself is really important. And there are other things like late heart disease or secondary malignancies, effects on fertility that need to be monitored. That's a wonderful question because especially in adolescent and young adult patients, there's a tendency to say, oh, this has happened, I pause everything, I've got this diagnosis, I've got my treatment plan, put your nose to the ground and get through it. And afterwards, I've noticed with many of my patients, it can hit them, what they've been through. Going through cancer at a young age is a substantial burden, and it can make you feel a little different than from some of your peers at work or school. Understanding that as a result, you may be at a higher risk for depression, anxiety, or even post-traumatic stress disorder is important. Doing check-ins with yourself about how you're doing and how you're feeling, and seeking help from your healthcare team if something isn't right with either your mental or your physical state is really important. Monitoring for signs of recurrence is something you can do by paying close attention to your body. I'm not saying you need to be thinking about it every minute or even every day or every week, but if something that's not normal for you is going on and it's persistent and worsening over time, that's probably something that warrants bringing attention to your healthcare provider. I'm talking about things like worsening pain, weight loss without trying, fevers, chills, drenching night sweats. These are all things, but really anything that's out of the ordinary for your healthcare status. Now, of course, you're going to get coughs, colds, and have joint aches and pains just like other people without a lymphoma history develop. For you, if it's getting worse and not improving, especially if it's been several weeks or even months, you need to get evaluated and connect that with your lymphoma history. Lymphoma survivors have many resources available to them through the Lymphoma Research Foundation. So there's a lot of patient education materials, not only for the newly diagnosed and people going through treatment, but for survivors. And there's a hotline that you can connect and be connected to additional support resources. Additionally, most lymphoma centers of expertise around the country have survivorship programs where attention is paid to things like diet and exercise after or during cancer, long-term effects, your general health going forward. It's important to reach out and ask about those resources if they haven't been offered, because they're really beneficial to survivors.